Welcome to this on-demand video, which will address the tracking and reporting as one of the 4 core elements of outpatient antibiotic stewardship as defined by the Center for Disease Control and Prevention, also known as the CDC. The primary goal of this project is to increase the number of outpatient settings that have incorporated all 4 core elements of the outpatient antibiotic stewardship, and will be releasing a video per month until all elements have been discussed. The core elements themselves, as well as the tools and strategies for implementing or enhancing them, will be the focus of this presentation. Specifically, we're asking emergency departments, emergency services, urgent care centers, physician offices, clinics, and community pharmacies to view and implement at least one strategy to increase your organization's tracking and reporting for antibiotic stewardship. My name is Deanne Richards, and I'm an infection prevention project specialist with the Lake Superior Quality Innovation Network that serves Michigan, Minnesota, and Wisconsin under the Centers for Medicare and Medicaid Services Quality Improvement Organization program. The core elements of outpatient antibiotic stewardship provides a framework for antibiotic stewardship for outpatient clinicians and facilities that routinely provide antibiotic treatment and were developed through the combination of consolidating evidence-based antibiotic stewardship practices and building on or adapting best-known practices for antibiotic stewardship across other clinical settings. In September, I reviewed commitment as the first element of the 4 core elements, and in October, I discussed action for policy and practices. If you did not have an opportunity to view these videos, you can access them through the webpage www.lsqin.org/initiatives/ASP/. Today's topic is tracking and reporting. The National Strategy for Combating Antibiotic-Resistant Bacteria aims to reduce inappropriate antibiotic use by 50% for monitoring conditions in outpatient settings by 2020. By tracking antibiotic-related diagnoses such as upper respiratory infections, you can monitor if your actions have an impact on your organization's reduction goals. Regardless of what elements you're going to choose to track, you first need to establish a baseline, determine your reduction goal, develop a plan for improvement, implement the plan, rerun the data collection and determine if an improvement has been made, and finally, based upon your current data, design and implement a secondary plan to help you reach your goal. So how does an organization track and report antibiotic stewardship? I'd make the following suggestions for organizations to consider in order to implement at least one tracking and reporting system. This is also known as audit and feedback. Considerations include, will you track individual clinician level? This is actually preferred, especially when you combine it with evidence-based practice education or you compare to peers. Or will the data be collected on a facility level? What's the time period that you will use? The data does not need to be collected continually, but rather you can determine such as a use of a quarter to establish your baseline or 6 months, and then you can periodically monitor again for that same amount of time period to see if your actions have been successful. Which sources of data will you be using, such as the electronic medical record, manual extraction, or using measures that you're already collecting, such as the Healthcare Effectiveness Data and Information Set, also called HEDIS, which includes appropriate testing for children with pharyngitis, appropriate treatment for children with upper respiratory infections to avoid the use of antibiotics, and avoidance of antibiotic treatment in adults with acute bronchitis. Do you focus on high priority conditions that are known to potentially be treated with antibiotics but are not recommended? This includes upper respiratory infections such as acute bronchitis. The data we recommend you collect includes what the diagnosis was, the antibiotic. The reason we encourage you to collect this data is that from there you can determine whether antibiotics would be recommended, if it was recommended if the primary secondary antibiotic was chosen, as well as the correct dosage and duration ordered. Regardless of your data outcome, this needs to be reviewed and opportunities for improvement determined and then actions taken. You can also look at the percentage of all visits leading to antibiotic prescriptions, and this is done by determining the total number of antibiotic prescriptions as your numerator, and your denominator is the number of patient visits regardless of the diagnosis. Now this can be done again as a system or individual prescriber with comparison to that patient population. This audit may be limited as there can be variations in coding practices as well as a diagnosis shifting where the prescriber records one code so that it would be considered appropriate for an antibiotic to be prescribed, but this was not the primary reason for the patient seeking care. Complications to tracking and reporting can include Clostridium difficile, drug interactions, adverse drug events, or antibiotic resistance for common outpatient pathogens such as Staph aureus. Again, monitoring and sharing the outcome of your goals is a great way to keep your team on track and focused on the outcomes. If all clinicians in a practice participate in the improvement project, tracking and reporting can include participation in continuing medical education and quality improvement activities related to antibiotic prescribing. For solo practices or practices with fewer than 5 clinicians, and all clinicians are participating, tracking and reporting can include self-evaluation antibiotic prescribing practices with updated evidence-based recommendations, and clinical practice guidelines can be utilized. The Center for Disease Control does provide recommendations related to upper respiratory infections. Additional items in the area of community pharmacy settings can include tracking calls made to provider to record if they adopt or reject recommendations related to antimicrobials known as rate of acceptance. Be sure to share best practice recommendations during the call. This includes review for agent, dose, and duration. Pharmacies can also track overall antimicrobial percentage dispensed each month. Establish a notification level of when to alert your local public health when you exceed your baseline. Track callback to individuals who had antibiotics dispensed the previous 24 to 48 hours earlier. Track and report any complications, as well as when recommendations are made for the customer to recontact their provider. Finally, immunizations are a primary means of prevention, and tracking includes recording in your state record the vaccination was given in order that other providers at other locations and settings can view the information. In Wisconsin, we've referred to this registry as the Wisconsin Immunization Registry, also known as the WIR. Although the core elements provide a framework for outpatient antibiotic stewardship, implementing the elements requires thoughtful and consistent efforts to achieve desired outcomes. This includes developing strategies and preparing individuals, facilities, or organizations for change, developing and testing antibiotic stewardship interventions, identifying and addressing barriers to change, and evaluating your progress towards your stated goals. Outpatient settings remain a crucial component of antibiotic stewardship in the United States. Establishing effective antibiotic stewardship interventions can protect patients and optimize clinical outcomes in the outpatient health care settings. LSQIN participants are encouraged to refer to your toolkit, which contains additional information on tracking and reporting. Individuals outside of Michigan, Minnesota, or Wisconsin are encouraged to contact your local quality innovation organization. Thank you for joining me today, and I hope you'll take advantage of all 4 videos on outpatient core elements.